borderline diagnosis, है ना? So if physician document a diagnosis with the term borderline, okay, suppose diabetes or borderline hypertension, the correct coding approach depends on whether ICD 10 cm recognize these term or not. So what you need to do, you need to go into the borderline, then you need to identify diabetes, or in the diabetes you need to identify the borderline. Okay. So if you find the entry, then you need to code that only. Okay. So if physician mention, okay, borderline hypertension. So what you need to do, first go to the hypertension and check borderline, or you need to do the reverse, borderline, then check the hypertension. If you are able to find that code, then you need to code it. If you are not able to find the borderline code, then you need to code normal hypertension. Yeah. So in this case, like in case of the hypertension, we have an entry for borderline hypertension. Okay. So we will not code hypertension in that case. Okay. So let me show you. So first we need to go hypertension. Okay, hypertension. Now we need to check borderline. So in hypertension, we have an entry of borderline. So that's why we will take this code rather than the hypertension I-10 code. Okay. And if you do not find borderline here, in that case, you need to take I-10. Yeah. Got it? But you will not get in case of diabetes. Okay. So here it's also again the diabetes code is also there. Earlier these codes were not there. So let me check diabetes also. Borderline diabetes. Earlier we normally code diabetes. Now we have code for borderline diabetes also. Diabetes. Diabetes, and then you need to check borderline. Mhm. So what we have taken in that case, pre-diabetes. Yes. So we have pre-diabetes. Yeah, it's a secondary due to gestational. Okay, let me check in the borderline. In diabetes, would not find the entry for that. VOR. Yeah, we have this. Okay. In borderline, we have diabetes. Yeah, mellitus R73.03. Hypertension. R03 point, the same code which we have got. Yeah. We got same code here. So like In hypertension, they mention that's why I told you to search both places. Either in the hypertension, you need to search the borderline, or in the borderline, you need to search the hypertension. Okay, so you will find the code. Okay, so we have both the code. Okay, any query till now?
We find different codes.
No. You always find the same code. Okay, it's not like that. One place you find A code and another place you find the B code. So whenever you find, you will always find the same code. Okay. Then we have some practice exercise, है ना?
Yes.
So practice exercise, you can I will share this document today with you, so you can do the practice exercise. But you need to put all these guidelines: exclude, include, code first, combination code, laterality rules. So these all rules you need to implement while you search this. So like urinary tract infection plus acute pyelonephritis, okay? Renal cyst plus kidney stone, okay? So you need to find all these codes, okay? So this is for your exercise. I will share with you today. Okay. Actually, I have not uploaded this document on the website yet. On the website, there is a different document, the older one. So we are working to update this is the newer one document. Okay. So once it will be updated and in the correct form, then we will upload it into the website. So what I need to do, I will like share you. Okay.
In Kumar and 1996.
Okay, 1996. So I give you an expiry option. I give you 5 month access till September. You will have the access. Okay. Share it. Now you have this document. Okay. Then we have general rule for principal diagnosis selection. Okay. So what is principal diagnosis?
For pain diagnosis.
Actually, there are sequencing. There are multiple boxes. Box 1, box 2, box 3. So principal diagnosis is the diagnosis which we need to put on the box 1. Okay. Always assign the principal diagnosis based on the main reason for the hospital admission or visit. Okay. But suppose if the patient came for abdominal pain and he had kidney stone, so you cannot make abdominal pain as the principal diagnosis. You need to take kidney stone because abdominal pain is the symptom of kidney stone. Okay. So kidney stone is the only diagnosis which you need to code in this scenario. Okay. If the patient present with symptom and a final diagnosis is established, code only the final diagnosis, which I told you. Okay. If no definitive diagnosis is made, code the symptom that prompted the visit. So if patient came with the abdominal pain and there is no diagnosis that the physician found, then you need to code abdominal pain as the principal diagnosis. Okay. Check this example. Patient present with the abdominal pain, final diagnosis gallbladder stone. The final coding will be gallbladder stone only. So you are not supposed to code abdominal pain because it's a symptom of the gallbladder stone. Okay. Second example. Chest pain because we do not have any other diagnosis. Okay.
Kidney failure.
What I told you, acute and chronic.
Acute.
Acute will be the principal diagnosis. Okay. Clear?
In this scenario, we need to code both.
Both. Any query till now? No? Okay. Now we are moving to chapter specific guideline. Okay. So what are chapter specific guideline? There are some diseases we need to follow some rules to if these diagnoses come into your medical records. Okay. So what I need to do, I need to stop this video here.